Hi folks, Nick Colantuono, Certified Financial Planner, here with Johnson Brunetti up in our Boston, Massachusetts offices. And thank you as always for joining us on our Money Wisdom Question series. Today's question is a fantastic one, and often when we're meeting and sitting down with folks who are either retired or getting there shortly, one of the biggest concerns that folks like you often have is, Nick, how do I budget for healthcare expenses in my retirement years? Well, folks, let's unpack it. There's really 5 things that I want you to be thinking about when it comes to healthcare expenses. The first is just estimating what those total lifetime costs will be. A lot of institutions have done some pretty serious focus groups and studies on this over the course of clients that they've had progressing through their retirement years in need of healthcare. The average 65-year-old couple should ballpark somewhere in the $300,000 to $400,000 lifetime range for these healthcare expenses. Guys, that's a massive number, right? Having to save $300,000 or $400,000 just to live your life and pay your bills might seem like a lot of money, but now knowing that, well, you only need that $300,000 or $400,000 just for the what ifs of healthcare, you certainly see the need to have a plan here. The second thing I want you all to consider is just accounting for Medicare. Medicare is not the be-all and end-all for health insurance or for healthcare needs for our clients. And in fact, there's a lot of costs that go in to Medicare, to all those different premiums. Part B, for example, you should be ballparking anywhere from $2,000 to $3,000 a year for those premiums. Part D, these are your prescription drugs if you need them. You should be ballparking anywhere from, I would say, $500 a year to $1,000 a year for those premiums, for those out-of-pocket costs and expenses. Don't forget your Medigap. Don't forget your supplemental plans. That's anywhere from another $1,500 to $2,000 a year in premiums. And on top of all that, you're going to be hit with those, one-off out-of-pocket expenses. So you need to be aware that, maybe you have to budget another $1,000 a year for that. So when it comes just to Medicare, be thinking somewhere in the $7,000 to $10,000 a year range just to pay those premiums and be covering those costs. The third thing I want you to think about when it comes to health expenses in retirement, inflation. You need to plan for the fact that not only is the world we live in getting more and more expensive every day, but these healthcare costs are ballooning like crazy. Whenever we're ballparking inflation rates for healthcare, we're using at least 5-6% per year. So when we're doing projections, when we're doing models, when we're running our retirement analysis for our clients, we're assuming that their day-to-day costs increase, but we're also assuming that the what-ifs of these healthcare costs are also increasing and at a pretty rapid rate through your retirement years. The fourth thing I want you to consider, especially if you're still working, really try to maximize those tax advantage accounts that you have access to. Things like HSAs, if you're covered by a high deductible plan through your employer, you could be making a tax deductible contribution into that health savings account. Your employer might even kick some money in for you as well. The money grows tax deferred, and if it comes out for a qualified health expense in retirement, 100% tax-free. It's very odd, it's very rare, I shouldn't say odd, it's very rare to find a triple tax leverage account like the HSAs. So if you're still working and you're covered by a high deductible health plan and you're not yet enrolled in Medicaid, in Medicare, please consider that HSA as a viable option that might make a lot of sense for you. Finally, the last thing, the fifth thing I want you to think about, you have to consider the what-ifs of needing some sort of long-term care. This is where I want you to ask some serious questions about your family health history, maybe your own health history. Is there anything in your medical records that might come back up and rear its ugly head in a couple years that maybe you're not really, thinking about too seriously right now? And when we're talking about long-term care, there's a couple different phases, right? The first phase is just home health care, and this is where 9 out of 10 people, initially start receiving long-term care benefits in their own house. And maybe you're in a position where you can't cook, you can't clean, you need help bathing or dressing or administering medications. You have someone come in maybe a couple days a week to help you with that sort of thing. A more graduated level of care are things like assisted living facilities, where now you're not living in your house, you're living in a facility where you might not be receiving around-the-clock care, but it's there for you if you need it. Obviously, the costs associated with that are pretty significant. And then, of course, what we're all too familiar with, the memory care units, the Alzheimer units, or furthermore, things like nursing homes where, we see the folks that go there, they're not there for a very long time. That's a very end of life level of care where you're getting around the clock care and constant care and being looked after. So obviously the expenses as you graduate from one level of service to another from a long-term care standpoint just get more and more and more expensive. So clearly, folks, there's a lot here to unpack. There's a lot of things that you need to consider when budgeting for healthcare and retirement. And hopefully this was a great start. If you found this video helpful, please feel free to share it with a friend. Don't forget to like or subscribe to our channels so you don't miss any of this awesome content going forward. So folks, again, Nick Colantuono here with Johnson Brunetti, and thank you for joining us on our Money Wisdom Question Series.